Hello, my name is Jackie Fritz, and I'm here today to inform you about the medical term blood pressure. Now, we all have heard this term, but do we really know what it is? Blood pressure is when the blood is being exerted against your arterial walls. This can also allow doctors to know what kind of condition your heart is in. Now, when learning blood pressure, we want to know two words. One, systolic. This is when your heart is contracting. Two, diastolic. This is when your heart is at rest. When recording blood pressure, you want to write the systolic number on top and the diastolic number on bottom. Now, when speaking aloud about blood pressure, you want to say 120/80, and you're going to need two pieces of equipment when recording blood pressure. This is the stethoscope. This will allow you to hear the patient's heart contracting and relaxing so that you can hear an accurate number. This is the sphygmometer, which is in increments of 2 millimeters of mercury. Now, there are two conditions of blood pressure. There's hypertension. This is when there's high blood pressure. The systolic number is higher than 120, or the diastolic number higher than 80. This is caused by overweight, high intake of sodium, lack of exercise, family history, cigarette smoking, and of course stress. This is also a cause of heart attack in human beings around America. The other one is hypotension, which is low blood pressure, and this is when the systolic number is lower than 90 and the diastolic number lower than 60. What causes this is abnormal heart rate, liver disease, over-the-counter medicines, heat exhaustion, being pregnant, and traumatic and emotional stress. Now I'm going to demonstrate on Royce what the proper way of taking a blood pressure. I need you to sit over here and have your arm relaxed, please. Thank you. Sleeve up. You want to make sure this is nice and tight around the patient's forearm. You want the sphygmometer facing towards you, so this way you can have an accurate reading. It's not tangled. Make sure this is nice and tight all the way, righty-tighty. Now you're going to put your stethoscope on, in your ears. And you want this over the brachial artery, which is located on the antecubital space. Now you want to pump this up to 180. It's not necessary to really pump it any higher, so this way you can hear. Now I'm going to listen for the first sound here, which is the systolic number, like I said. Okay. 126/76. Take this off. Thank you. Okay. In conclusion, blood pressure is very important when it comes to the human body. We always want to make sure to keep a record of this, so this way we can tell if your heart's getting any worse, so the doctors can help you. Also, blood pressure can be easily read and accurately measured and is an important indicator to cardiac and circulatory health. Now, I hope you guys have learned about blood pressure.
Thank you.
And this way you can use it in your daily life.